many states and localities and the federal governments issued bars to married women's employment. Employed women during the 30s faced incredible hostility, and that hostility fell particularly hard on women of color. And I could say more about that, but I'll set that to the side. Women were also drawn more broadly into the decade surge of labor activism. Female union membership in the 1930s increased to 300%. So I think this is an important thing to think about in the face of severe unemployment, what kinds of responses and ways that women are drawn into activism. But equally significant to labor unions, and I think deeply relevant to today's experience, was a wave of housewife-led militancy and consumer strikes. Historian Annalise Orlick calls this organizing by housewives a nationwide uprising by mothers against the high cost of living. So you had mothers in New York City, Seattle, Richmond, Virginia, Los Angeles, all across the country. You had immigrant and native-born mothers, Black and white mothers, Jewish and Christian mothers. This was truly a sort of broad-based nationwide movement. These women staged anti-eviction protests, consumer boycotts, rent strikes, protests for better education and affordable public housing. They created large-scale barter networks where people could trade food for labor. They lobbied for legislation to regulate the costs of staple foods and housing. These activists thought that government should regulate prices as well as wages in order to bring down the high cost of living so that all Americans could afford decent housing and basic staples. So in 1935, I'm going to give you one quick example. Housewife activists organized a nationwide meat boycott where they fought price gouging for meat. They burned down warehouses where suppliers were hoarding meat to inflate prices, and they lobbied legislators to establish price controls on meat as a basic staple of life. This tradition of a housewife-led movement against the high cost of living lasted into the early 1950s. One final and kind of quick and quirky point about the 1930s that I think is interesting in light of discussion today about COVID divorces or COVID babies was the widespread use of contraception in the 1930s and its legalization in 1936 for married couples. And it's in the 1930s that we see this kind of bottoming out of the birth rate that set the stage for the baby boom in the 1940s. So boomers are, they come in the next generation. So quickly, just a few words about the lessons about that I take about where we go from here on women's equality and rights. And I'm a little hopeful. I think that it's possible that valorizing nurses and female essential workers could be leveraged to advance crucial aims of better pay and improved working conditions in caring professions. I think that fears of getting sick on the job, along with their anger at terrible pay, may bolster unionization for frontline low-paid service workers where women predominate. We are already seeing calls for organizing rent strikes, campaigns for affordable housing, and other ways to reduce the cost of living, as well as barter networks that parallel those of the 1930s. I'll just say quick bottom line about all of my examples and the analogy to the present is that nothing happens automatically, that crises in and of themselves don't lead to greater change or advancement for women's equity. Rather, change that produces equity happens because of organized activism in response to gaping inadequacies of the system that crisis exposes. I'll stop there.
That's fascinating. Thank you so much. And finally, to end, and I will say that some of your questions are already being answered by some of the guests because we are running over. This is such an important topic. We want to go to Mimi Lind, Venice Family Clinic Directors of Behavioral Health and Domestic Violence Services. And she can give us a little bit of the view from the ground, from a clinic here in LA, and what they're seeing in terms of access to services, domestic violence, and other health situations. Mimi, are you there?
Hi, and can you hear me okay?
Hi, yes, hi.
Okay, well, everyone's had amazing things to say, and I'm so honored to be here, and I will be 2 minutes. because I know we're running late. And I know there's been a couple of really good questions about domestic violence, so I'm going to also incorporate that. And I'm also happy to do this another time to just talk about domestic violence if you want to invite me back anytime. So again, my name is Mimi Lind, and I'm the Director of Behavioral Health and Domestic Violence Services at Venice Family Clinic. We're a large free clinic in the west side of Los Angeles, and we serve about 28,000 folks, just no matter their economic or their immigration status. So we have a lot of undocumented folks and a lot of people receiving Obamacare as their insurance. We provide medical care from birth to death, and we also have a domestic violence program. We have a mental health services program and early Head Start, as well as a substance use program. So I'm just to let you know what we're seeing. Well, actually, first, just to start, that we're all on the same page. When I say domestic violence, I'm talking about intimate partner violence. They're the same thing. We moved from the word domestic because a lot of folks that were experiencing domestic violence weren't domestically living together. A lot of people are in a relationship, they're not married, or they're exes. And we know that the highest rates of murder is when the victim tries to leave. And so when you read in the newspaper that someone's been murdered by their partner, it's usually an ex-partner, or once the victim talks about leaving. And again, to clarify, domestic violence is the use of many types of abuse: physical, sexual, financial, using the kids, and emotional, name-calling, shaming, and using social media to hold power and control over a partner or an ex-partner. So that's what we're talking about, those dynamics. So that's domestic violence definition. And unfortunately, what I'm suspecting, because I haven't seen any great statistics right now, and maybe a lot of the researchers on the call have, but we haven't seen necessarily an increase in the calls to hotlines that I've seen, but I think there's big reasons for that. At our program, for example, we have lost a lot of the opportunities for some of the informal ways that we are able to identify victims or survivors of domestic violence. One of them, for example, is when you come to the clinic, every woman, right now it's just women, we ask from 12 years old and up once a year about domestic violence in their lives right now or in their past. And when people are not coming into the clinic, it's much harder to ask those questions. Now we've moved to screening people over the phone, but because of lockdown, there might be sitting right next to their perpetrators, or the perpetrator asks for them to put everything on speaker so they can hear what's being asked. So a lot of opportunity is lost in that way. The other thing is that we know that the stronger the relationship we have with a patient, the more they'll open up about. And that's true for all of us with our provider. Think of the things that you might tell a provider, your own provider, that you might not tell, the person taking their place for the day. And so when you have a relationship with someone at the clinic, and it might not be your doctor or your nurse practitioner, it might be the person checking you out. It might be the security guard that you've been seeing for 20 years. Our clinic's been around for 50 years, so we have long-term relationships with our clinic, with our patients. We've lost some of those informal connections where the person might be that one moment where they feel like opening up or telling the truth. The other day I was talking to a victim on the phone, and she called for the first time in many years and said, "I can't take it anymore. My husband lost his job. He's home all the time, and he's regularly raping me in bed while I'm sleeping. And he had a night job, and so now he's home." And so that time for her that was a peaceful, safe time is no longer. We know that there was a study at UCLA years ago that said that the increases of domestic violence increase with unemployment. And so everything we've talked about today speaks to that. And there were a lot of questions today about the different cultural experiences, differences of rural and urban. And we know that domestic violence is a pandemic. And I don't mean to misuse that word, but it is. It's across all cultures, all counties, all small villages and huge cities. I don't know of any culture that hasn't experienced it. or any religion. It's across the board. And I've worked in Boston, in Costa Rica, I've lived in France, I've lived in Hawaii and Los Angeles, and everywhere I go, I hear about communities and domestic violence. And so it truly is cross-cultural. I think the only thing that's different across cultures is maybe the way they do it. Some cultures might do public shaming more. Some cultures might use more physical abuse. But across the board, there's a lot of domestic violence everywhere. So I'm going to kind of stop because we have very little time. I have lots to say, but let me just add two good things that are happening. In Los Angeles, you can continue to get a restraining order at the courts. So even though the courts are closed for everything, you can still get a restraining order. The other thing about specific to Los Angeles is when you call a domestic violence hotline, they can help you get into a motel. A lot of the shelters now have a voucher program where they can't take you into their shelter, but they can take you, they can try to help you get in a motel if there's still space available. So there's a little bit of light at the end of the tunnel with some of the beautiful things that are happening and some of the ways that women's safety, because the vast majority of victims of domestic violence are women. And so there are some ways that women are being seen. So thank you, Ananda.
Thank you, Mimi. I know that we are short on time. A lot of the questions have already been answered by the speakers, actually. So I know Sandy had a burning question to ask.